All right. Good evening, everyone. Welcome to another session, patient education session. Of course, we're here to give you more information and to teach you more things about, certain disease conditions and also how best we can help you and to let you get better faster. Now, today we're talking about something that's very topical, and especially, during the rainy time. Well, let me not say the rainy time, but for us here in Mandeville, it's been raining from morning, or actually from last night it has been raining. And I know whenever it rains like this, the next day everybody comes to the pharmacy with coughing and running nose and, all kind of stuff start happening to you. So today, we're just looking at sinusitis versus the flu, that's a shortening, and that's influenza. And what are the differences and how can they be treated? I know everybody has had one of these conditions before, and as a pharmacist, I can tell you that a lot of persons come to the pharmacy because of these conditions. Up to today, so many persons enter the pharmacy asking for medications to treat these conditions. So my job tonight is to help you to understand what are the differences between sinusitis and the flu, influenza. So, what if I told you that everybody has sinus? Some people will say, no, I don't have sinus, but everybody has sinus. What if I told you that influenza or the flu is different from sinusitis? What if I also tell you that flu cannot be cured? What if I tell you that sinusitis cannot be cured? And what if I tell you that treatment is available for sinusitis and the flu? So today we're going to be examining all of these things. But before we go in any further, let's look at the two main factors here. And so we speak of sinusitis, and what we're going to do, we're going to look at them separately. We're going to look at sinusitis, and we're going to look at influenza. That's what we're going to be doing. Okay, so let's start by doing this. What are the sinuses? And if you look on my presentation, you see it says paranasal sinuses. And the reason we put paranasal sinus is because sinuses are everywhere. It's all over the body. But I say paranasal sinus because paranasal sinuses are small spaces in the skull. All right? So, and a sinus is any opening that you can only enter in one. It's an air pocket that you can only enter in one direction. That's why we call it sinus. So, the paranasal sinus, so to just make a distinction, we're saying that we're talking about today of the paranasal sinus. So let's look at what they are. And here you see a diagram of the head, young female. And as you can see here, we're pointing out to you what are the different sinuses here. And as you see, there are 4 pairs of sinuses, or 4 pairs of paranasal sinus. You have the frontal sinus, the ethmoid sinus, the maxillary sinus, and the sphenoid sinus. Now, if you notice where they are located, the frontal sinus is just above the eyebrows. And oftentimes when you say you're having sinus headache, you always point to the front of your head, just above your eyebrows. That's where you might tend to have some pain. If you look at the ethmoid sinus, it's just below the eyebrows, also to the side of the head, and you see, or to the front of the, just below the eyebrows, but right just above the nostrils. Then you have the maxillary sinus, it's right in the cheeks, and that is another sinus that I know whenever we say we're having sinus problems, we always point to these areas. And then now the other one is a sphenoid sinus, which is just beside the ear, okay? So just to make some distinctions, so there are 4 pairs of sinuses. And with these 4 pairs of sinuses, this is what we call the paranasal sinuses. All right? So just to give you a quick idea, and this is why when you say you have your sinuses, you're having sinus problems, you always tend to have pressure or pain at these areas: frontal, ethmoid, maxillary, and sphenoid sinus. All right, so just to give you a quick highlight of what the paranasal sinuses are. So let's now jump over to the flu or the influenza. Now, some scientists believe that humans probably acquired influenza when they began domesticating animals like birds and pigs. Now, so, we know of different kinds of influenza, different kinds of flu, and you always hear about avian flu, which is bird flu, and the H1N1, what we say come from the pigs, all right? Now, this happened when we started to domesticate these animals, and let me just say that it is a belief, and there's reason to believe that this happened because of this kind of domestication. Now, the flu epidemic started with the rise of agriculture and permanent settlement. Now, so when we start to domesticate these animals and start to do more agriculture, so they are more in a stable area, so that's what may cause us to start develop the flu, or the flu might be passed on to humans. Now, let's look at a little history about the flu. Now, while we do not know when the flu started, but it has been around for ages. We don't know exactly when it started, but we know it's been around for a long time. And it's something that it's not a new condition. So if you experience a flu or symptoms of the flu, it's not unique to you. And the symptoms that you have is not unique to you alone. All right? Now, the first recorded outbreak of the flu was in 1580. So that's a whole heap of years ago. All right? Now, I'm sure that the flu would have been before that, but the first recorded outbreak was done in 1580. Now, another recorded outbreak occurred in 1729, and this was in Russia, and it spread throughout Europe within 6 months, and then across the world within 3 years, since 1729. Now, there was another recorded outbreak in China, and China seems to be, I don't want to sound biased or sound, biased towards China, but if you notice here, there's another outbreak happened in China. This was in 1781. And yet another was in 1830 to 1833. However, the first modern flu pandemic occurred in 1889. It was a Russian flu. And guess what? It affected 40% of the world's population, and that's a large amount of persons. And this was in 1889. Now, when this occurred, it spread right across the world, and a lot of persons were infected with the flu. And bear in mind, in these days, we didn't have much medications like we do now, so you can just imagine how much persons died. And then one of the most deadliest, one of the deadliest outbreak of the flu was in 1918, and that was the Spanish flu. And records have shown that between 20 to 50 million persons died during this time. So you see, the flu has been around for a while. And when you think about it, during these times, there were no vaccines, no drugs available to treat the influenza. So the flu is can be a very deadly condition. So what is the flu then? The flu, it's a contagious viral infection that affects the nose, throat, and lungs, which are all part of the respiratory system. So it's safe to say then that influenza or flu affects the entire respiratory system. So the nose, the throat, and the lungs. So these are the major parts of the respiratory system. So the flu affects this part of the respiratory system. Okay, so this is one distinction that I want for you to understand first. Okay, so what are the symptoms of the flu? And I'm sure anybody who is on the live now can say that they have experienced some symptoms of the flu. What I'm going to do is highlight some of them now, and I'm sure you'll be able to identify with some of them. Sore throat. That's one of the first things that we start to experience is the sore throat. And I just said in the previous slide that the flu symptom, the flu virus, affects the throat, nose, and lungs. Runny nose. So sore throat, runny nose, stuffy nose. Some persons have runny nose, some persons have stuffy nose, and some of us even have both, runny, stuffy nose. Fever is another one that is another symptom that's experienced from the flu. Coughing, and some terrible cough that we might be experiencing. Headache, muscle aches and pains, feeling weak and tired, sweating and chills. So these are some of the main symptoms that you experience when having the flu. And I'm sure that those of us who are listening in now can identify with all of these symptoms because it has happened to you at some point in time. Now, in the previous slide, we pointed out the different areas or the paranasal sinuses, and we also spoke about where the flu, what part of the body the flu affects. And we said the nose, throat, and lungs. And if you notice here, all the symptoms being mentioned of the flu affects all these areas. The sore throat, runny nose, stuffy nose, while fever, which is all over the body, the coughing from the lungs, because when you cough a lot, it's because the body is trying to get rid of the excess mucus that might be there. The headache, because of the congestion, the muscle pain, feeling weak and tired, sweating and chills. So now that we have looked at some aspect of the flu and what the flu is, now let's look at what is sinusitis. All right? So remember, we're doing a comparison of both of them, sinusitis versus the flu influenza. Now, sinusitis is an infection of the lining of the paranasal sinus, which you spoke about just now. And these infections most often happen after a cold or after an allergic response. Now, there are 4 types of sinusitis. And I bet a lot of us didn't know this, but all we know about is that we're having sinus, okay? Or sinusitis. But there are 4 different kinds of 4 different types of sinusitis, and I'm just going to show you them now. You have acute sinusitis. Now, these symptoms last for 4 weeks and get better with the right care. So if you're taking care of yourselves correctly, the symptoms that you have will not last for more than 4 weeks. So acute sinusitis lasts for 4 weeks, okay? Or less than 4 weeks, okay? So that's the first one. The second one is what we call the subacute sinusitis. These type of infections does not get better with treatment at first. So symptoms may last for 4 to 8 weeks. So when you come to the pharmacy, or when you go to your pharmacist, or you go to your physician, and you complain about the same situation over and over again within that time, it's not because the medications never work, it's just that you're having what we call subacute sinusitis, okay? So, and this may go on for 4 to 8 weeks. And I know of a lot of persons who have experienced this before, because you're getting the symptoms over and over again. So, and it's there for a while, you're not getting better, you're taking the medication, but you still feel the same way, and you're getting miserable, and we can understand all of that. But the medications alone is not going to be enough, especially if you're experiencing what we call subacute sinusitis. And then we also have what we call the chronic sinusitis. Now, chronic sinusitis infection happens with repeated or poorly treated acute infections. And these symptoms last 8 weeks or longer. 8 weeks that's 2 months. All right? Now, in the chronic stage, when you reach this stage, it means a couple of things. One, you might not be taking your medications correctly. 2, you might not be taking any medications at all. And 3, you could just be taking them as you feel like. So you take a medication today, you feel better, and then you stop taking the medication, and then tomorrow the same thing starts back again. So this will put you into a chronic state, chronic sinusitis. And then the last one, we call this the recurrent sinusitis. So if you have 3 or more episodes of acute sinusitis in a year, it's called recurrent sinusitis. And I'm sure a lot of persons can attest to this, where you're having the sinusitis reoccurring so many times within a year. So more than 3 times. And so you keep on you wondering, you see the medication's not working, when what's happening to you is what we call a recurrent sinusitis. So just to edify us again, we have 4 different kinds of sinusitis: the acute sinusitis, subacute sinusitis, chronic sinusitis, and recurrent sinusitis. All right? So, look at this, and you can see where you can identify with some of these conditions. So, let me just kind of break it down a little bit now for you, each of these situations. Now, let's look at acute sinusitis. Acute sinusitis is caused by the common cold or a viral infection. You should feel better within 10 days, though symptoms could quickly stick around for as long as 4 weeks. All right? You'll experience the following symptoms when you're having acute sinusitis. So just to edify you, make notes where you can. If you want to make notes, if you need to make notes, make some notes about this. Now, with acute sinusitis, this is what happens to you. You have stuffy nose or nasal congestion that makes it difficult for you to breathe through your nose. So some of the time, I see persons come to the pharmacy and say, I can only, they're trying to breathe through their mouth and having a shortness of breath because of the stuffy nose and the congestion. So it's because of the acute sinusitis. Now, so these are the other symptoms. You have thick green or yellow mucus draining from your nose, a runny nose, which is running down the front of the nose, and some of the time it runs in the back of the throat, which we call a post-nasal drip. So you ever come to the pharmacy or ever feel something tickling in the back of your throat before? That's what we call a post-nasal drip, right? So even though it's not running down the nostril or running down the nose, it's running down the back of the throat, it's still a sinusitis. So that's what we call a post-nasal drip, because it's at the back part of the nostril. Another symptom of acute sinusitis is pain, pressure, swelling, and tenderness along the nasal passage that feels worse when you bend over. And I'm sure that you've tried that before, that some of the time when you're having all of this, you start to hold on your head because you don't like the feeling, so you try to hold on your head a bit, but you start feeling worse. Even might start having some kind of dizziness too because of that. You also may get headache, pressure in the ear, cough, and other unpleasant symptoms. And all of this occurs when you're having an acute sinusitis. All right? So, stuffy nose, nasal congestion, thick green or yellow mucus running down the nostrils, or some have running in the back of the throat, which you may not see, pain, pressure, swelling, and tenderness around the nasal passage, which we showed you earlier when it comes to the anatomy of the paranasal sinus. And also, you may also get headache, pressure in the ear, coughing, and other unpleasant symptoms. See, I'm sure you can identify with some of these. Chronic sinusitis. Chronic sinusitis brings on the same unpleasant symptoms as acute sinusitis. And, but however, it will last longer. You won't be diagnosed with chronic sinusitis until you have the symptoms for at least 3 months, and it's not clear what causes chronic sinusitis. However, there are many things that can increase your risk, which includes the following. So, while we might not know what caused the chronic sinusitis, but some risk factors these are some of the risk factors that may cause you to move from an acute state to a chronic state. One, nasal polyps. What are these? Nasal polyps are small growths inside the nostrils. And some persons may see this for themselves. When you look inside the nostril, you will see some little things hanging down. It's not boogle. Let me not put it that way. I mean, some always say boogle, but it's not the boogle we're talking about, all right? That's dried up mucus. In Jamaica, we call it boogle, but that's not nasal polyps, all right? You may have what we call a deviated nasal sputum, which is what separates both nostrils, and that's what we call the sputum, and in which the bone and cartilage that divides your nose gets pushed to one side. So if one side of it is pushed, so let's say if somebody thump in your nose and damage that cartilage there, then it may cause that to happen. It may be at birth or so, but oftentimes this is due to an injury. All right? Allergies may cause, recurrent allergies may cause chronic sinusitis, and recurrent respiratory infections can cause chronic sinusitis, and even diseases that affects the immune system. All right, so there are certain disease conditions that can affect the immune system, and if that happens, then it may cause you to fall into chronic sinusitis because the body is not able to fight against what is causing the inflammation of the sinus. As we go on more, I'll speak about what may cause the sinusitis to occur. Hold on. All right, so we also have the subacute sinusitis. This type of sinusitis falls between acute and chronic. It lasts more than 4 weeks, but less than 12 weeks. Your symptoms may not be as severe as those you will experience if you had acute sinusitis. So most of the times we experience most of the unpleasant symptoms during the acute state, all right? But this is the subacute. So it's between chronic and acute. That's why I call it subacute. Now, the recurrent sinusitis is another situation that may happen. And if you get acute sinusitis four or more times each year, you have what we call a recurrent sinusitis. Some of the same risk factors for chronic sinusitis also increase your chance of recurrent sinusitis, such as nasal polyps, deviated sputum, and other abnormalities that can occur in and around the sinuses. If you regularly inhale tobacco smoke or other irritants in the ear, you may have a higher risk of recurrent sinusitis. Sinusitis also raises your odds of developing bacterial infection, which in turn makes recurrent sinusitis more likely. And I want for you to underline that part, the bacterial infection. And that is maybe some of the main reason why you have what we call a recurrent sinusitis. All right, let's look at the sinuses now. And we showed you earlier, so I want to identify now what a healthy sinus looks like and what sinusitis looks like. If you looked on the left, which depending on how you're facing the screen, to be your left, the healthy sinus. If you notice inside the sinus, it's clear. There's no obstruction there. There's nothing at all inside the healthy sinus. The frontal sinus is quite clear. The ethmoid sinus is quite clear. The maxillary sinus is clear. However, if you look on the right, where the sinusitis is, you look that it is blocked, it's congested. You see the redness, you see the mucus developing on those sides. So you have the inflammation, which causes the redness. There's an obstruction at the opening. I remember what we said earlier, that the sinus, there are small openings into the ear pockets. So there are some ear pockets there inside the skull, but there's only one opening, and that is just to come out. Okay? Now, when the mucus is built up, then that is what causes the blockage. But just to let you also understand that the reason for the build-up of the mucus, right, is to allow to clean the passage, to clean your nostril, because what the mucus does, it clears the bacteria, it clears the dust, it clears whatever is causing the unpleasantness inside the nostrils, and that's what the purpose of the sinuses are, to keep the nasal passage clean. That's what it does. It also helps to make your head lighter, because these are spaces inside the skull. It makes your head lighter, so you can hold up your head better. All right. So that's another function of the sinuses. However, for this presentation, the main reason for the main purpose of the sinus is to help to keep the respiratory system clean and clear and rid of dirt and dust and also get rid of bacteria. That's why when you blow your nose, some of the time, particles might be, if you look at your mucus, there might be particles in it because the sinus is getting rid of it. All right. So while we spoke of, the acute sinusitis, chronic, subacute, and recurrent, let's look at the other kinds. There's also fungal sinusitis, right? I'm sure some of you might not have known this before, but there's fungal sinusitis. Now, this is caused due to a fungi. Our fungi are living organisms that include mold, mildew, and mushrooms. I know of there might be instances, let's say for example, if you're cleaning somewhere and there's a lot of mold in the room or a lot of mildew in the room, these are fungus. And what it will cause to happen, it may cause you to develop a fungal sinusitis. And these come in, give you the same kind of symptoms as in acute and chronic sinusitis, but it caused due to a fungus, okay? There's also allergic sinusitis. Now, allergic sinusitis is due to dust, pollen, smoke, and other environmental irritants that you breathe in that can trigger the sinusitis. So, at certain times of the year when you have a lot of pollens in the air, let's say it's like, for example, like during the mango season when the blooms are around, or when the apple season when the apples are around and the blossoms are out there, you tend to inhale these pollens, and they will have what we call allergic sinusitis, because it is in response to the trigger, which is the dust, the pollen, the smoke, that may cause it. But allergic sinusitis can can cause a unique symptoms. All right, so itchy nose, eyes, and throat. Symptoms can go and come with the season as the number of allergens in the air change throughout the year. So depending on the time of the year, you may have an allergic reaction, or you might have allergic sinusitis. So you should be aware of what season, especially for those persons who experience these problems quite often. All right? So fungal sinusitis and allergic sinusitis. So let's look at bacterial sinusitis versus viral sinusitis. Now, I bring this in because oftentimes a lot of customers, a lot of patients, as soon as they start to feel sick like this, the first thing you want is to ask if you can get antibiotics, okay? And so let's look at bacterial sinusitis versus viral sinusitis. So both types of sinusitis are infections that cause similar symptoms, but they are not the same and are treated differently. And this is very important for you to understand that we do not, while they are the same, while they might give the same symptoms, but we do not treat them, the treatment is not the same for both. Most sinusitis is caused by the common cold, and a common cold is a virus. So if you are having a viral sinusitis, the use of antibiotics would not be beneficial for you. There's no cure for a viral sinusitis. Instead, you have to just wait it out until it goes away. So the symptoms typically begin to fade after 5 days to a week. So what do you do then? We will explore that in further slides. But the viral sinusitis from the common cold, all right? And there's now the bacterial sinusitis, it is caused, on the other hand, by a bacteria, and it stays longer than the viral sinusitis. And this can go on for 1 week to 10 days. You can treat the symptoms the same way you treat those of the viral sinusitis. However, your bacterial infection can get worse and may not get better after 7 days. When this happens, of course, we recommend that you go and see your doctor. But at this point in time, you would need antibiotics to kill the bacteria that is causing the infection. All right? So just to highlight, the bacterial sinusitis versus the viral sinusitis, the symptoms are the same, however, the treatment is different. All right, just to show you something real quick, a little video to show you what happens. Remember we spoke about the symptoms that happens and the virus itself and how it can be spread. So let's I'll show you a quick video and show you what happens when you sneeze. All right, so you saw that video? That video shows you what happened. Let me play it again. And that's why we say cover your nose, cover your mouth when you sneeze. And you see it right there? You see almost droplets coming out of this gentleman's mouth? And can you imagine if you were standing near to him or just a little bit of distance away from him? Let me just play it one more time to show you what happens when you sneeze. Not nice, not cool, doesn't look good. All right. Okay, so what do you do when you sneeze? Let's look at these five animations that are there. You see the first two persons is an X over them head. The first one, no covering of the nose, not at all, no cover. The second person, have them both hands covering their nose and mouth, which is not the right thing to do either, Because when you sneeze in your hand, right, in the mid palm of your hand, you going to take the same hand if you shake somebody else's hand. And we don't want that to happen, okay? Because that's how you start to spread. Third person, notice you sneeze in your elbows. So you sneeze in your elbow. So put your elbow over your face. That is the more appropriate way. Or if you have tissue paper or any other handkerchiefs or anything at all to prevent the droplets from spreading across the room, then you cover your nose with that. And then the fifth person has on a mask, which is also another option to keep when sneezing. So bear this in mind. We want to prevent the spreading of any virus or any sickness. Do these things. Cover your nose when you're sneezing, or put your face or your nostril in the elbows when you're sneezing, or just wear a mask. All right. For those who are online, I just show you a little picture of this gentleman. I don't know if anybody at all how good you are at knowing faces or so, but this gentleman right here is a very popular person. Let me just say, if you notice the cap that he has on, this cap is a West Indies cap. So obviously he plays cricket. And no, it's not Brian Lara. Some of you might be thinking it's Brian Lara. No, it's not Brian Lara. And this gentleman he's a Jamaican. He's not Chris Gayle. And it's not Waiver Lines. All right, and it's not Jimmy Adams. All right, this gentleman's name is Lawrence Rowe. Now, Lawrence Rowe, the reason I'm showing this picture of Lawrence Rowe is that Lawrence Rowe was one of the best batsmen that has played for West Indies. He's the first cricketer to score a double century on Test debut. And I put this picture up of Lawrence Rowe because you play cricket outside in the grass, and Lawrence Rowe had this very unusual situation whereby he is allergic to grass. All right? He has hay fever and he's allergic to grass. So can you imagine, you play cricket, you're always in the grass, but you're allergic to grass. However, Lawrence Rowe was one of the best batsmen to ever play the game. You might not know much about him, but I'm an avid cricket fan. I love cricket. It's my first sport that I really love that much, next to football. But you can go on, if you love cricket or you follow cricket, Google or just YouTube Lawrence Rowe and watch him bat. Excellent batsman, right-handed batsman. But I show you the picture of him because of his allergy to grass, and the fact that we're talking about allergic sinusitis, we're talking about sinusitis, or we're talking about flu. So can you imagine what he went through while playing the game, being allergic to grass? Thank you, Lawrence. All right. So we spoke about sinusitis, we spoke about the flu, and so now let's look at when does the flu becomes dangerous? Now, the flu, as simple as it is, we know a couple of years ago, we had an outbreak of COVID, COVID-19, which is a flu virus, which is caused by a flu virus. And so, we look at when does the flu becomes dangerous? First, when you start having trouble breathing or shortness of breath, do not take it lightly. If you're having the flu and symptoms going on for more than 5 days, or you start to having problem breathing or shortness of breath, please speak to your doctor. If you start having chest pain or pressure in the chest, it's not a good sign. that's when it's becoming really dangerous, especially if you're an asthmatic. Please do not take it lightly. If you're having ongoing dizziness, so you're feeling dizzy for 3 consecutive days, this is when the flu is becoming dangerous for you, or the symptoms of the flu are becoming dangerous. Difficulty waking up, or confused, or confusion. So let's say, for example, that you went to bed and you just can't wake up at all, and because the flu is upon you. It's because you're getting tired, you're getting dehydrated, you're getting weak, so you're having difficulty getting up. And when you start to get dehydrated, you start to get confused. Confusion starts to set in because of the dehydration. And let me also say that with the flu, the virus itself causes dehydration. So with this dehydration, that is what is causing the confusion. So therefore, it's very important that while we're saying that it becomes dangerous when you start having dehydration, that's why we always say drink lots of fluid. I know a lot of us like to say, no man, sweat it out, or go play some football and sweat it out. No, I do not recommend that you do this. If you are having the flu and dehydration sets in, do not sweat it out. Do not run it out. Do not play football to get rid of it. No, no, no. It will make you get worse. The dehydration can lead to seizures. So when you're dehydrated, and because there's not enough fluids going around and the electrolytes get less, then you can start to have seizures. All right? So it's very important for us to understand that the flu it is very dangerous when these things start to happen. Shortness of breath, chest pain, dizziness, difficulty waking up, dehydration, and even seizures. And if you have an underlying medical condition and you start to see it getting worse, it could be due to the flu, because the virus itself affects the immune system, and when the immune system becomes affected, then if you have any other underlying disease condition, then it may make it get worse. So if you're diabetic, if you're hypertensive, or any other underlying conditions, then it can get worse because of the flu. Severe weakness or muscle pain is another danger that we look for when you're having the flu symptoms. So if you find that you're weak, you're just constantly weak, pain all over the body, joint pain, muscle cramps, and all of that, you're getting worse. So don't take it lightly. And again, don't just drink some bush tea, or that alone, I guarantee you, will not be enough. All right, what are some of the risk factors of the flu? And there are several risk factors, and I will just highlight a couple of them, no, 3 of them. And the risk factors of the flu are, 1, older and younger age. So the older persons, younger persons, tend to be at risk for the flu. Now, seasonal influenza tends to have worse outcomes in young children, especially those aged 2 and younger. Adults older than 65 also tend to have worse outcomes. Now, why? So let's say, for example, the younger kids, 2 years and younger, their immune system are just beginning to develop, right? Now, when the virus attacks their system, it makes it more difficult for them to fight against the virus. In addition to that, because of the runny nose that they have or the coughing that they may have, as adults, we are able, if we are coughing, we can spit out the mucus, we can get rid of the mucus, we can blow our nose and all these other things to get rid of the mucus. However, kids 2 years and younger, they do not understand to cough up a cold and to spit it out. They basically will swallow it back. You understand? And likewise, if they're having runny nose, they're more likely going to lick off their nose, all right, or lick off their mouth. So this may cause the flu virus to reoccur in those kids. So it's very important that we pay attention to our young kids or young children, that if they're having all of these symptoms going on, that we try to prevent them from doing these little things that they do to having the recurrent. Older persons, as you get older, the body gets weaker, and also you may have other underlying disease conditions, and because you have other underlying disease conditions, it puts you at greater risk of the flu virus. Pregnant women or pregnant people are more likely to develop influenza complications, particularly in the second and third trimester of the pregnancy. So, pregnant ladies, this one is for you. If you plan to get pregnant, I'm not saying that you will pick up the flu virus, but you are at risk. You might be at risk in the second or third trimester of the pregnancy. And as regards to treatment for pregnant ladies, the treatment is limited. It's because when medications are tested, we don't test medications on pregnant people. It's unethical to test medications on pregnant ladies. All right. So in terms of treatment, it is very limited. All right. Another risk factor of the flu is chronic illness. So, as mentioned before, as you get older, you might have chronic illnesses. So chronic conditions may cause the risk of influenza complications. Examples include asthma and other lung disease, diabetes, heart disease, nervous system disease, if you had a previous history of stroke, like metabolic disorders, problems with the airway, kidney, liver, and blood disease. So all of these chronic conditions, if you have any of these chronic conditions, then you are at risk of developing the flu. And when you develop it, or if you do develop it, your chance of recovery takes longer. So it's very important that you try as much as possible to keep healthy, stay healthy, and do the right thing, okay? Always speak to your pharmacist. Once these situations start to occur, please speak to your pharmacist. I know the pharmacist might be the easiest person to get to. Speak with them. If the situation is still getting worse, go and speak to your doctor. All right. How to control the spread of flu? We're coming from COVID a couple of years ago, and I'm sure we remember all the things that we need to do when we're having, to prevent the spread of the flu. A lot of us were under quarantine for a long time. You couldn't come out. You had to go in by 3 o'clock, and you have to stay home. You can't come out until 6 o'clock in the morning. And so we understand what it meant or what it feels like during these times. So what are some of the ways to control the spread of the flu then? Wash your hands. Wash your hands well and often with soap and water for at least 20 seconds. Make sure you wash your hands properly, rub them together, keep it under running water to get rid of whatever virus might be left. It's not foolproof. However, this is one way to control the spread of the flu, especially now when we're having all of these, this time of the year when it's a little bit chilly, especially for those of us who live in Mandeville. It's a little bit chilly some of the time, so please keep your hands clean. Avoid touching your face. Keep your hands away from your eyes, nose, and mouth. Helps to keep the germs away from these places. Remember that the flu affects the respiratory system. If it affects the respiratory system, it will enter the system through your eyes, nose, mouth. Okay? So try not to touch them all the time. Cover your coughs and sneeze. Remember we showed you earlier how to cover your mouth when you're sneezing or when you're coughing? Not with your hands, but with your elbows. It's cough in your elbow. All right? Or sneeze in the elbow. Do not sneeze in your hands. If you're going to sneeze in your hands, ensure you have tissue or you have hand towel or a handkerchief to sneeze into. Clean the surfaces regularly. So especially for those of us who work in the pharmacy or those of us who work in area where you have a lot of persons coming in all the time, every now and again, they're in your space. So if you work in an environment where you have to deal with customers on a continuous basis, please to ensure that your countertops are always kept clean. This is one way of preventing the spread of the flu. And lastly, avoid crowds. Avoid a lot of crowd. This will also prevent, the spread of the flu. So, quickly, what you need to do to prevent the spread of it: wash your hands, avoid touching your face, cover your coughs and sneeze, clean the surfaces, and avoid crowds. So, let's do a quick recap. Sinus versus the flu. All right? Let's look at the flu first. So the flu is highly contagious. Highly contagious. Okay? When something is highly contagious, it means that it is easy to spread from person to person. All right? So it's very important that we understand this. The flu, highly contagious. Next thing, the flu is caused by a virus. So virus causes the flu. It primarily affects the respiratory system and it affects all age groups. So this is a quick recap of what the flu is all about. All right, now let's look at sinusitis. Sinusitis, on the other hand, is not spread from person to person. Okay? Let me repeat that. Sinusitis is not spread from person to person. However, whatever causes the sinusitis is what may cause you to develop sinusitis. So if I am here and I have sinusitis, I'm not the reason why you catch it, okay? Because I don't spread it from me to you. It's because it's not spread from person to person, okay? Sinusitis is caused by the common cold and pollutants, okay? So whatever is in the air is what may cause the sinusitis. And it's important for us to understand that, because once we remember that sinusitis is an inflammation of the sinuses, that's the paranasal sinuses. It primarily affects the paranasal sinuses. And sinusitis also affects all age groups. Okay? So, take your notes. The flu, contagious, caused by a virus, primarily affects the respiratory system, affects all age group. Sinusitis is not contagious, it's not spread from person to person. It is caused by a common cold and pollutants. It primarily affects the paranasal sinuses, but it also affects all age groups. So let's look at how do we treat this then? If this is such a dangerous situation, how do we treat this situation? How do we treat the condition? All right. For the flu, we look at vaccines. So vaccines is one of the main treatments for the flu. Okay? Vaccine shots are available, and guess what? Every year there's a different one that is available, that is made available to treat, or that is for that is available for prevention of the flu. So normally, time of the year you might get the vaccine is normally maybe September and October, or to be the ideal time for you to get the flu vaccine. Control the spread. So another treatment of the flu is more, so flu, as you notice here, is more, the treatment is more preventative. So use of vaccines, control the spread. Drink lots of fluids. It's very important that you drink lots of fluids. Drinking the fluids helps to rehydrate. Remember, we said earlier that the flu dehydrates. So drinking fluids will rehydrate. When we say fluids, we not talk sweet sugar and water, okay? Because a lot of us love to drink sweet sugar and water, and that doesn't help. That makes it worse. I'm not talking about sweet juice or orange juice, because orange juice has a lot of sugar in it. So when I mean orange juice, I'm not, the concentrated orange juice is filled with sugar. So I'm not talking those, I'm talking clear fluids, coconut water, anything that is low in sugar. You have to avoid sugar when you're trying to rehydrate. And another treatment is administration, or to administer medications for the symptoms that each person may have. So let's say, for example, you're having headache or you're having fever. So we might give you paracetamol for the fever. We might give you some ibuprofen, or those kind of medications that will help to get rid of some of the symptoms that you may experience while experiencing the symptoms of the flu, okay? So let's look at it again. Use of vaccines is very important. Control the spread, and that's by doing preventative measures. So don't cough too much. If you're coughing, ensure that you cover your nose and mouth when you're coughing, and administer medications that will treat the symptoms that each individual is experiencing. Rest. You have to rest. Don't run up and down. It's a lie. It's not true. It is not true. At our last patient education session, we spoke about sleep and how sleep is important to rejuvenate the body. So if sleep is so important to rejuvenate the body, if you're having the flu symptoms, if you're getting weak and tired, you have to rest to help the body to rejuvenate. Okay? So it's not true that you should go and play football if you're having the flu. Not true. And I'm saying it again. Not true. Rest. That's what you're supposed to do. Take your medications, eat something, get something to eat, take the medication and go and rest. And that is how you will get better. Okay? If you go play football and out and about with everybody, you know what you're doing? You're basically spreading the virus. That's what you're doing. You're spreading it. You're letting somebody else get in flu. And that's not fair. If you have flu, keep it to yourself. All right? Keep it to yourself. Don't give it to anybody else. Right. So rest is a very, very important aspect of treatment of the flu. Let's look at sinusitis. Now remember, we said that sinusitis is an inflammation of the sinuses. Now an inflammation of the sinuses is caused by the release of what we call histamines. And histamines causes the release of mucus, okay? And that's what causes congestion in the nostrils. So if histamines causes the congestion, then what we need to do is use antihistamines, so something that works against histamines. So we use antihistamines to treat sinusitis. What are antihistamines? Or what medications have antihistamines? So you have loratadine, which is a very popular one that we use. We have cetirizine, which is another one to treat sinusitis. We also have fexofenadine, which is another one. And we also have chlorpheniramine and DPH. Everybody knows DPH. But all of these medications that I just made mention of, all of them are antihistamines, and you should ask your pharmacist about them. So go to the pharmacy. If you're having these symptoms that we spoke about earlier of sinusitis, ask your pharmacist, what antihistamines can I use to treat my sinusitis? Okay? But before you even do that, please explain to them the symptoms that you're having. Once you explain the symptoms that you're having, it makes it easier for your pharmacist to recommend the appropriate medication to treat you. Okay? So the use of antihistamines is very, very important, as one of the main treatment for sinusitis. Antibiotics. We mentioned earlier that you can have a bacterial sinusitis, and which is what which we may call rhinosinusitis. So therefore, the use of antibiotics becomes very important. Okay? How do you know that you might need antibiotics? Speak to your doctor. Your doctor is the one that will determine if antibiotics are necessary. However, sometimes you can know that you're having a bacterial sinusitis. Very easy. You might the odor of your breath might change. It may have a fruity smell or an unpleasant odor, which may tell us that you're having a bacterial sinusitis, and antibiotics becomes important as part of the treatment in this instant. The use of nasal sprays. So nasal sprays, because of the congestion that you have, then the use of nasal sprays becomes very important, because the nasal sprays get rid of the congestion. And what nasal sprays are available? So you have mometazone, you have fluticasone, you have Afrin, which is something that you can get over the counter at the pharmacy, but some of the others you may require that you get a prescription from your doctor. All right? However, always ask your pharmacist about these medications that you can use to treat your sinusitis, or if you're having symptoms of sinusitis. Decongestant. What are decongestants? So decongestants are medications, as the name suggests, because of the congestion that you're having. We need to give you medication to get rid of the congestion, and that's why we call it decongestant. Okay? Now, what are decongestants? How can you find decongestants? You always go to the pharmacy, you buy these multi-symptom medications. So these medications that may mark multi-symptom on them has decongestants in them. Okay? So if you're having stuffiness, you're having stuffy runny nose, you might need a decongestant. Okay? And so anything that is multi-symptom will have or should have decongestant in them. Ask your pharmacist. Do not choose by yourself. Always ask your pharmacist. Steroids, and I'm not talking about anabolic steroids here. I'm talking about use of steroids, okay? Some steroid use might become necessary to treat the sinusitis because of the inflammation, and steroids can be used as anti-inflammatories also. Okay? Again, your physician, your doctor, will decide on the use of steroids if it is necessary for you, the patient. Painkillers. Because of the sinusitis, you will have pain, you will have cramps, you will have headaches, you will have all these things. So the use of painkillers is very important to treat the sinusitis. Now, would you need all of these medications at once to treat sinusitis? No. And that's why it's very important for you to speak to your pharmacist, tell them what is happening to you, and they will be better able to advise you on what medications you need to treat the situation that you are experiencing at that point in time. Do not just go into the pharmacy and just buy some medication and then come back and say the medication did not work. I recommend that you buy medications under the advice of your pharmacist. Okay? Very important, very important. So, with all that being said, I'm happy to say that is the end. Thank you very much for tuning in and following all the pointers that I give. And now it's your time to ask some questions or pose me some questions. I'm sure that there are a lot of information that was presented, and you might want to ask 1 or 2 questions, or you might have a concern, or you might be someone who has been having chronic sinusitis and you want to know what to do and how to treat. Now is your time to ask me any question that you want to ask me. If there are any questions, please go ahead. You can post it on the YouTube, or if you're on the Zoom, you can also post it on the Zoom. It's one of the main trick to ask some questions or post me some questions. No question. Okay, cool. No problem. Yeah. All right. So there's no question to be asked. So, which suggests that the information given was clear and concise, and we all understood. And I'm glad to say that I always say, always ensure to ask your pharmacist if there's any information that was presented here and you're not sure about it. Please speak to your pharmacist also. Your community pharmacist, ask them, or if you want to speak to us at Gateway Pharmacy, you can always call us. You can send us a message at 876-472-8218. That's our WhatsApp message. Or if you want to call us, you can call us at 961-3726 or 961-4784. We're willing and able to answer any questions or any concerns that you may have, to make it clearer for you and to recommend whatever treatment that you may need. So, again, I thank you for tuning in and following our patient education session for today. Just to let you know that you can tune in again on Thursday on Mellow FM for our radio show or 10-minute radio feature, Hola Meds. Don't miss it. It's at 2:45 every other Thursday. And that's this Thursday at 2:45, our radio show or radio feature, Hola Meds. I will be talking about something very topical. You don't want to miss it. All right? You don't want to miss that one. And also, just to advise you that at Gateway Pharmacy, we provide you with all different services, and we open from 8 a.m. to 9 p.m. Mondays to Saturdays, and on Sundays we open from 9 a.m. to 6 p.m. All right. So, somebody asking a question? What's it? I'm not seeing it. Okay. Somebody is trying to speak and not available. There's somebody that's trying to ask a question. Oh, on which one? On the Zoom or? Somebody have them hands up. I heard that having sex regularly cleared up sinus. Is that true? I'm not sure about that one, but I guess that if you're having a sinus problem, and I am expecting that you will feel weak and tired, so I'm suspecting that you might not have that desire to have sex, but if you want to try that, you can try it. I won't give a stamp of approval for it. However, you can, if you try it and it works, you can let me know. But I am not aware. I am not aware of that situation. But I don't know about that one. But again, if you want to try it, then you should try it. There is somebody on Zoom that is trying to ask a question. Yeah. You can unmute. All right, unmute your mic. Go ahead and ask the question now. I'm not hearing. Not hearing. You can go ahead and talk, but unmute your mic. I'm not hearing you.
Yes, Dane, my mic has been unmuted for the longest while, but I'm not hearing you. Go.
Not hearing.
Hello, 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 hello. Oh, perfect, man. Finally. Alas. Excellent, Dean. As I said, I'm not sure what was happening, but I've been trying to get in for the last 15 minutes. But I'm grateful that I'm able to do so before the ends. Yes, sir, Dean. And super excellent present. Yes. It very informative. The information was easy to digest. And in my view, you covered all the boundaries as it relates to sinusitis versus the flu. Um, some very salient points. And I must add that I've seen an increase in persons turning up at the pharmacy with sinus-related complaints, sinus-related issues. And I am of the view, I've been doing an unofficial study in the area that I've practiced. And I noticed persons, especially in those congested or highly populated schemes, that constantly have issues. And I'm suspecting that one, the close proximity of the houses. Two, I think that some of these houses are infested with moles. And 'cause most of the time they are locked up. Persons work out in Kingston, they come in the night, they're hardly open, no penetration of sunlight or anything like that. Maybe the type of painting, etc., etc. And poor ventilation, right? So these
Right.
persons come with fans and AC that maybe they're not properly maintaining. And apart from that, too, from a dieting point of view, poor nutrition, compromised immune systems, etc. So overall, it's an excellent presentation, one that I think is worth it. One that I think is worth it. One that I think is worth it. No, you can't wait on it. Right. And I'm really happy that I was able to join in. So once again, let me say on behalf of Gateway Pharmacy, you guys are doing an excellent job. I mean, I look forward to these monthly presentations, and I'll encourage more persons to spread the word because vital information free of cost. Uh, Free of cost. You have an opportunity to ask questions. So I think it's something that we should capitalize on. And Mr. Thomas, I really endorse what you're doing and admire the fact that, despite the fact that you're so busy and I wear many hats and have many things to do, you still find the time to give back. Because for me, this is giving back. Because I couldn't pay for this because this is consultation work. I'm getting you to come and do a presentation like that. So big up yourself and good information.
Thank you, sir.
Thank you, sir. Thank you, sir. Thank you, sir. Thank you, sir.
Why is it feeling bad? Just take it off. It's feeling Thank you very much, sir. Go ahead. All right. Thank you again, everyone, for joining in on today's presentation. It's always I'm always happy to share these information with you, and stay tuned for another one that will be coming up at the ending of March, and do not hesitate to, as Paul said earlier, do not hesitate to share the information that you learned tonight with your friends and family. You know, sooner or later, if you follow these Zoom meetings each night, you know, you might just become a pharmacist because you're learning so much, you know, and you should soon be able to start to diagnose people and make recommendations about medications, because this Zoom is these presentations is really you know, an enjoyable thing for me to share with you and to give you knowledge that I acquired over the years after my 25 years of being a pharmacist. I really enjoy doing this. So thank you again, and we see you again on the last Tuesday in March. And however, we still continue to do our radio feature on Mellow FM, and it's every other Thursday, and the next presentation will be this Thursday at 2:45 on Mellow FM Live. Okay? Thank you again for joining us, and see you again soon, and enjoy the rest of your evening.